When we think about what makes us healthy, our minds usually jump to things like genetics or diet and exercise, right? But what if I told you one of the biggest factors is, well, it's your address? That's what we're diving into today. This whole field called GeoHealth, which is built on this incredible idea that where you live can literally shape how you live.
So what's the thread that ties them together? I mean, think about it. We all spent so much time glued to those interactive COVID maps, right? Watching the spread in real time. But here's the thing. The big idea behind those amazing high-tech maps, it didn't come from satellites or supercomputers. Nope, it all started way back over 160 years ago with a terrifying mystery in the streets of London.
So, let's dive into our first section, a story about a deadly mystery in Victorian London.
Okay, I want you to picture this. It's London, 1854, and there is absolute panic in the streets. This horrible disease, cholera, it's just sweeping through, striking people down so fast, and nobody, I mean nobody, has a clue how it's spreading. The entire city is just gripped by fear.
So, in the middle of all this chaos, you've got this one physician, Dr. John Snow, and he had this radical idea. Everyone else was blaming it on bad air, miasma. But Snow, he just wasn't buying it. He thought the killer wasn't in the air at all. He thought it had a location, an address.
And the stakes could not have been higher. We're talking about the Soho neighborhood, where over 500 people died in just 10 days. Think about that. The clock was absolutely ticking. Snow had to prove his theory, and he had to do it fast. So what did he do? Well, his method was revolutionary for the time. I mean, medicine was still in its early days, right? But Snow, he didn't reach for a microscope. His most powerful weapon was going to be a simple map of the city streets. And his detective work was just incredible. He literally went door to door, talking to people, collecting data on every single death. And when he put all of this information on his map, this horrifying pattern just jumped right out. The deaths weren't random. They were all clustered, packed together right around one specific spot.
Snow himself later wrote about it, calling it, and I quote, "the most terrible outbreak of cholera which ever occurred in this kingdom." You see, his map wasn't just a bunch of dots and lines. It was a picture of a disaster as it was happening.
And all that data, every single dot on that map, pointed to one place, the public water pump on Broad Street. That map was the smoking gun. It proved, without a doubt, the contaminated water was the killer, not some mysterious bad air. So he took his map to the local officials, convinced them to remove the handle from the pump, and just like that, the outbreak stopped.
But here's the bigger picture. Snow's map did way more than just stop one outbreak. It basically gave birth to a whole new field of science, all built on this idea, the power of where.
And that field? It's called epidemiology. It's really the core science of public health. Think of it as the art of being a disease detective. You're trying to figure out the patterns, who gets sick, with what, when, and, this is the key for us today, where they get sick. Now, epidemiologists have this really simple but super powerful model they use. It's called the epidemiologic triad. You can think of it like a recipe with 3 essential ingredients for any disease to happen. First, you need the agent. That's the what, the germ or virus. Then you need the host. That's the who, the person who gets sick. And finally, you need the environment. That's the where. It's the place that brings the agent and the host together. And see, that was John Snow's genius. He figured out the environment, the water pump, and he changed it.
Okay, so that's the foundation. Now let's fast forward to today. Let's see how modern disease detectives are using the exact same principles, but with tools John Snow couldn't even have dreamed of.
All right, we're jumping forward, 166 years from John Snow's London.
And we land right in a scene that is all too familiar to every single one of us. A new virus is spreading across the globe, and fast. And just like back in Snow's day, what was one of our most essential tools? Maps. We all lived by those COVID-19 maps. But wow, the technological leap is just staggering, right? I mean, look at this. Snow was using pen and paper. It took him weeks just to map out one neighborhood. Today, we've got these incredible digital dashboards pulling in real-time data from all over the world, and we can analyze it in seconds. The basic idea is exactly the same, but the power we have now is it's on a whole different level.
And this kind of tech isn't just for reacting to pandemics. We're actually using it to get ahead of the curve, to map out the health risks of tomorrow.
The applications are just incredible. We're talking about scientists using these geographic tools for everything. They're tracking how viruses like Zika genetically evolve. They're predicting where malaria will pop up next using environmental data. They're even analyzing social networks to stop the spread of STIs and using satellites to keep an eye on our air quality. It's amazing stuff.
So take that STI example. Researchers can now map not only where an infection is spreading geographically, but also trace the lines of the social network, the connections between people. And what this does is it gives us this crystal clear picture of how place and our social lives are totally tangled up when it comes to how diseases spread.
Or let's talk about a huge global killer like malaria. To figure out where the risk is highest, scientists are using these incredibly powerful models. So they might start with just analyzing the environment, looking for the right conditions. Then they layer on data about where actual cases are happening, and then they can run these super complex computer models, and as you can see, with each new layer of data, our ability to predict where the next hotspot's going to be just gets better and better.
And the level of detail we can get now is it's mind-blowing. We're not just mapping where a virus is anymore, we're mapping what it is. There's this whole field called phylogeography, and what they do is track the teeny tiny genetic changes in a virus as it travels around the world. It's like we're literally watching evolution happen in real time right on a map.
Okay, so what does all of this mean for you, for me, for all of us? Let's bring it all home and talk about your health and your location.
So what is GeoHealth? Well, this is it. It's this powerful mashup of geography, mapping, and that detective work of epidemiology. And the whole point isn't just to understand why people get sick, it's about using the power of where to step in, to make a difference, and to actually improve people's lives.
So from John Snow's simple, hand-drawn map to the incredible global dashboards we have today, it's clear that the power of the map has totally transformed how we fight disease. And that just leaves us with one big question to think about. As our data gets bigger and our tools get smarter, could it be that maps will become our most powerful form of medicine?